Welcome to the Newby Health Perspective with Dr. Newby. This is your go-to source for all things health and wellness with your host, Dr. Newby.
Good afternoon and welcome to the Newby Health Perspective, your go-to source for all things with health and wellness. I'm your host, Dr. Keith Newby, president of the James E. Newby Jr. MD Foundation, cardiologist, and market director for community health improvement and engagement with Bon Secours Health. And every week, I'll be here to guide you through the latest in the medical world, both past and present, ideas to consider, health tips and perspectives, and expert advice. So I always start off with my announcements. So I was in church and I heard a message from my pastor during service, and I thought about this, and I said, well, you know something? Let me go ahead and bring this up just to put it out there. During this Christmas season, what I want you to do is create for yourself an attitude of gratitude. Try to get out of your selfish ways about what you think you deserve for Christmas or any other holiday or birthday or whatever. If someone takes the time to provide you with a gift, be gracious and thankful. There are so many others with so little. And anytime you have this kind of self-centered nature, it's an insult to God. Our Lord made the ultimate sacrifice, laying down his life and endure suffering beyond belief for us to reconcile with God because of our treacherous ways. If it weren't for his sacrifice, where would we be? So I'm asking you, have an attitude of gratitude. Be thankful and do for others. Faith, amongst all else, supersedes how we live our life and what we should do, and it drives our ability to receive blessings. So create an attitude of gratitude. Anyway, moving right along. Today represents part one of my two-part series, Winter Health Essentials, how to stay warm, well, and worry-free this season. First, I wanted to do a quick shout out to Norfolk State University, particularly Michael Maison and Maynard Scales for providing me the platform in which I serve the Hampton Roads community. And most importantly, I shout out to my Lord and Savior, Jesus Christ, from whom all blessings flow. Part one of my two-part series is winter-related health news. So I want to talk about some current trends. Now, I want to update you on flu and RSV activity in Hampton Roads. Now, I know a lot of people will ask, what is RSV? Well, that's called respiratory syncytial virus, a common respiratory virus that causes infections of the lungs and respiratory tract. Now, while RSV often leads to mild cold-like symptoms, it can be quite severe in infants, older adults, and immunocompromised individuals. So when you hear the term immunocompromised, that means people whose immune system is compromised by various issues. And that could be age. It could be, say, if they're cancer patients on chemotherapy, or say they have bad lung disease and they're on steroids to help reduce inflammation. Those steroids will reduce the effectiveness of the immune system. So, any chronic illness where someone may have to take medications that may block immune response, such as connective tissue disorders like lupus, rheumatoid arthritis, those are considered immunocompromised individuals and are at risk. So the at-risk populations, again, infants under 1 year, especially premature, adults 65 years of age or older, individuals with chronic heart or lung conditions, and those, again, as I mentioned before, with weakened immune systems. Now, influenza is a viral infection caused by influenza viruses, primarily types A and B that affect the respiratory system. The flu can range from mild to severe and can result in hospitalization or deaths, especially in vulnerable populations. So it's kind of similar to RSV, meaning infants or children under 5, especially under 2, older adults, pregnant individuals, and those with underlying health conditions. Now, the relative importance of healthcare is both RSV and influenza contribute significantly to morbidity and mortality, particularly during seasonal outbreaks. So when you hear the term mortality, that means death. Morbidity is disease that comes about as a result of that infection. They are leading causes of hospitalizations in children and older adults. Now, the economic impact. These viruses increase healthcare costs through hospitalizations, emergency room visits, and missed work or school days. And as of December 22nd of 2024 in Hampton Roads, Virginia, there has been a notable increased activity in both influenza and RSV or respiratory syncytial virus cases. Now, in terms of current status, flu activity in Virginia is categorized as very high, with a significant increase in cases observed since early October. Now, in terms of regional impact, hospitals in Hampton Roads, including Children's Hospitals of King's Daughters, report a substantial rise in flu-related hospitalizations, particularly among children. Preventative measures, health officials strongly recommend vaccination vaccination of all eligible individuals aged 6 months and older. Additional preventative steps include regular hand washing, wearing masks in crowded settings, and staying home when experiencing flu-like symptoms. So in other words, don't be trifling and go out there and affecting other people because you feel like you have a need to go out. Remember, what you do impacts those around you. And again, we talked about that attitude of gratitude. Stop being selfish and self-centered and think about who you are affecting when you go out in public, especially if you know you're sick. So let's talk a little bit about the RSV, or respiratory syncytial virus. And the current status of that. RSV cases have surged in Virginia, reaching multi-year highs. And the regional impact, again, CHKD, or Children's Hospital of King George, reports that RSV accounts for approximately half of their inpatient cases. Half, indicating a significant burden on pediatric healthcare services. Who are at risk, we talked about this earlier, infants, young children, older adults, and individuals with compromised immune systems are at heightened risk for severe RSV infections. And preventative measures. While vaccines for RSV are available for certain groups, such as pregnant individuals and older adults, supply shortages have limited availability for infants. Preventative strategies include frequent hand washing, avoiding close contact with sick individuals, and disinfecting surfaces regularly. Standard things we did during COVID as well. We ask you to continue to do that, especially during these winter time frames. So general recommendations on as far as vaccinations. Stay up to date for all recommended vaccinations, including flu and COVID-19 vaccines. I just recently got my flu vaccine, and if I can do it, anybody can do it. Hygiene practices. Maintain regular hand washing, use hand sanitizers, and practice respiratory etiquette, such as covering coughs and sneezes. So again, etiquette. Don't be coughing all out in the open in front of everybody, putting your nasty germs on other people. Follow protocol and etiquette. Now, for more detailed and current data, residents can refer to the Virginia Department of Health's Respiratory Disease Data Dashboard. So just go online and look up Virginia Department of Health's Respiratory Disease Data Dashboard. So what are the significance of these infections, especially as it relates to healthcare disparities? Well, one is limited access. Limited access to preventative measures such as vaccines for influenza and early treatments, antivirals for flu, monoclonal antibodies for RSV disproportionately affects underserved populations, so Black and brown communities. Lack of pediatric specialists and ICU capacity in rural or low-income areas intensifies the impact of severe RSV cases in children. Now, as it relates to social determinants of health, overcrowding and poor housing conditions increase the spread of respiratory viruses. Nutrition and comorbidities, and when I say comorbidities, what I mean is other disease processes that could create a problem to get this type of infection, such as asthma, COPD, which is chronic obstructive pulmonary disease, diabetes, hypertension, are common in low-income populations and exacerbate these negative outcomes. So vaccination disparities, now we got to deal with that too. So influenza vaccine uptake is significantly lower in communities of color in low-income populations due to barriers like misinformation, mistrust in healthcare systems, and logistical challenges. Now, I think I went through this, a week ago when we talked about this issue of misinformation. Now, unfortunately so, and I blame the healthcare system, we did not do enough during COVID to push the issue of vaccinations from COVID-19 in terms of the mRNA vaccines. Now, I told you, I got folks that sit there and bug me about some doggone Ozempic and want that. And they'll smoke weed every day, yet they'll say they don't want to take a vaccine because they don't, quote unquote, know what's in it. I'm like, you ain't know what was in that weed you smoked. You ain't know what was in that Ozempic shot you took, but you're willing to take that with no problem. We have a misguided ideology of what's important and what's not. And we have to kind of get to a better sense and a different sense of this. I hear you on mistrust of the healthcare system. I'm not dismissing things that have been done in the past, but again, this is your life. You know, we have clear data out there in the literature that promotes use of vaccines. I don't care what anybody thinks they're telling you. I get these people telling me, oh, I did my research. You don't know enough about medicine to do any research that makes a difference or makes anybody understand you know what you're talking about. That's like me with banking or some other type of profession. I'm not a lawyer. I'm not a finance person. I could do research all day long, but I don't have the experience or know-how to make judgment calls to tell you how you should handle a legal situation or tell you how you should invest your money. And I think anybody that does that when they don't have the background in medicine and they're trying to give you advice on your health care is a fool. And I'll say that again, and I'll tell people that to their face. If you're giving people advice when you don't know, you don't. You think you know, but you don't know. You don't have the background, nor the education, nor the understanding of medical literature in order to make those kind of determinations. And I know some people may say sounds hardcore, but I don't really care because, again, people giving bad advice are out here killing people with their negative advice, and I can't have that, not my community. I have to stand up for those who can't stand up for themselves. So sermon's over for that part. The RSV vaccination for older adults and monoclonal antibody access for infants remain cost prohibitive for many families without robust insurance. So that is an issue, and that needs to change. What are some of the health outcomes? Well, Black and Hispanic populations experience higher hospitalization and mortality rates for both RSV and influenza due to delays in care and underlying health inequities. So what's the importance of addressing these disparities? Well, from a health equity perspective, targeted interventions, community-based vaccination programs can reduce the unequal burden of disease. Cost savings, preventing severe cases through equitable access to care reduces strain on healthcare systems. And maybe we should look at having vaccination clinics in churches or community centers in neighborhoods so that they can help to stave off disease processes and help the community. Public health, minimizing disparities in RSV and influenza outcomes strengthens overall community resilience to respiratory viruses. Now, again, I'm going to tell you, I don't like needles. I'm with you on that one. I got no problem with saying that. I got a nurse in my office. I swear she's the only one I will let give me vaccinations because she is like the bomb. I mean, I really feel much of nothing. So some of how people do or give vaccinations impacts how you receive them. But I tell you, as long as I can get my access to those people that know what they're doing, and I would just, hey, I got no problem with you asking people how many of these you've done. And some people are just better at it than others. But again, even those people I've had give me vaccinations that I think are just lousy at doing it, in the end result, that few seconds of discomfort versus what it can do for you from a health benefit perspective, I cannot emphasize enough to just go ahead and get your shot, be done with it, and keep it moving. So I think we should promote efforts to address these disparities, focusing on improving vaccine access, promoting education and awareness, and enhancing healthcare infrastructure in underserved areas. Now, the latest on COVID-19 boosters of vaccination availability, we got to talk about that. So as of December 22nd, 2024, COVID-19 continues to impact global health with new variants emerging and vaccination efforts ongoing. So what's the current situation? So we have emerging variants, a highly transmissible subvariant XEC is spreading in the U.S. and may become dominant during winter months. Vaccination developments, Australian researchers have developed a new mRNA COVID-19 vaccine targeting the receptor binding domain of the virus spike, potentially addressing issues like immune imprinting and offering better protection against variants. So as we learn more, we do better. And we are developing vaccines that are more effective and are more helpful. So importance of vaccinations. So we talked about this before as well. Protection against severe disease. COVID-19 vaccinations are effective in preventing severe illness, hospitalization, and death. And I tell you, again, how do vaccines work? Well, they target areas to build immune response. So what they're trying to do is have you develop your army in which you're going to fight these viruses. So think about if you go into a battle, again, I think I mentioned this last week or week before, if you go into battle, you want to have a strong enough army to fight the war and to potentially win the war. In order to do that, you have to have enough soldiers. If you go in there as a lone soldier amongst a kind of million other people that are against you, the likelihood of survival and success are not great. Vaccines help you fight these illnesses by building your own internal army so that when you're exposed to virus, you can overcome that virus by your soldiers being their soldiers. So that's essentially what a vaccine does. So, people tell me, I don't need a vaccine. I work out every day. And that's great. That may create a better issue for you so you can fight the virus better. But if you haven't been exposed to it, it's not going to matter. I mean, if you can work out every day, now you would do better than if you didn't work out every day. But that's not going to prevent disease processes from occurring because your immune system has never seen that particular virus in order to know how to fight it. So again, it's not about, part of it's about how in shape you are, but more importantly, it's your exposure to that virus, and that's where the vaccines come into play. They actually introduce a way for your body to recognize an issue so that when you are exposed to that virus, it knows to go ahead and target that and fight it. So vaccine availability. So global access. Vaccines are widely available with efforts to ensure equitable distribution. Local supply. In some regions, increased demand has led to temporary shortages, but overall vaccine availability remains sufficient. And should you get vaccinated? Well, heck yeah. Staying up to date with COVID-19 vaccinations is crucial, especially with the emergence of new variants. Vaccination reduces the risk of severe illness and helps control the spread of the virus. Now, for booster doses, certain populations, such as older adults and immunocompromised individuals, may be advised to receive additional doses for optimal protection. So I ran into this issue too, where every time somebody gets a vaccine, they're ready to say that the vaccine caused about 8 million other things. And I wish you stopped doing that and stop telling people that. You don't know. I got people that said they will have a stroke 6 months after a COVID vaccine, and they'll say, I got this stroke because of this issue. I got that vaccine, and that's what did it. I'm like, well, listen, Chief, you got hypertension, you don't take your medicine, you're bad diabetic, blood sugar's 400, you got cholesterol of 400, you smoke like a chimney. What do you think's going to potentially happen? How do you kind of come up with this idea that these other medical conditions have no bearing to this problem, of your stroke having occurred? And again, this is the kind of nonsense I got to deal with all the time. I'm not saying that these things don't happen, and there are noted effects negative of vaccines, but I can show you tons of data that shows the effect is good and worth the effort versus you showing me the 1 in a million people that may run into a problem with the vaccine. I mean, again, you stay faithful, you pray on God, to God for guidance. But I tell you, God put us together on this earth to help each other, and that's part of my quest. Is I let him guide me when I'm advising patients, and I let that faith I have in his word guide my hand to make sure I'm directing you in the right direction. God put us here for a reason. That's to help each other. And I agree, you have to have faith in God to get things to work, but you also, have to have faith that he's directing you, that maybe he's directing you to us to help you. So don't take it always as a negative thing. So what I would say to everybody is consult with your healthcare providers, though, to determine the appropriate vaccination schedule based on individual health status and local guidelines. So I know I've had some people that will ask me, should I take all these vaccines at the same time? I mean, personally, I'm not necessarily a big fan of multiple vaccinations at once. Don't have any data to support it, but this is my only thing. If you have multiple vaccinations at one time, the issue I have is if something happens, which one of them caused the problem? You don't know because you got 3 or 4 at the same time, and then you're not going to want to take anything after that. So to me, I'm more of a fan of getting the vaccination, wait a couple weeks, do the next one, wait a couple weeks, do the next one, and so forth and so on. That way, at least if something were to occur after one, you would know which one was the problem child. And again, you can do them all at once. I'm not saying don't. I'm just saying these are the challenges you have to make sure you look at with that. So somebody asked me recently, where do I find free or low-cost vaccinations in the community? Well, there are several options for that. I will start off always with, especially with COVID-19 vaccinations, your local health department. Oftentimes, they offer free COVID-19 vaccinations through local health departments. Residents can find vaccination sites and schedule appointments via the VDH website. That's VDH is the Virginia Department of Health website. Pharmacies and clinics. Many pharmacies, such as CVS and Walgreens, amongst others, provide COVID-19 vaccines at no cost. Walmart's another one, and I'm not singling any one out or others. You could check every pharmacy, for the most part, does them now. So check with your local one and see what they have. And most of them, especially if you have some type of insurance, you can get a vaccine at no cost. Uninsured individuals may also receive vaccines for free under federal programs. So you want to check with that and make sure. And I would start, if you don't have health insurance, always start with VDH first and move from there. You can talk to your local doctor as well, and many doctor's offices still do COVID-19 vaccinations. Influenza vaccinations. Well, you have several. Some of the healthcare systems in the area have historically offered free vaccine flu clinics throughout the area, and I would say check with your local healthcare system, be it Centera, Boston Coors, Riverside, Chesapeake General. Just check with any of them to see, do they offer them, and where and how can you get access to them so you can check and get your vaccinations for flu. RSV vaccinations. They are primarily recommended for older adults and certain high-risk groups. Availability may be limited and costs can vary. Residents should consult their healthcare providers or local health departments to determine their eligibility and locate vaccination sites. Now, additional resources, you can go to vaccines.gov. That's vaccines.gov. This federal resource provides information on vaccine availability, including locations offering COVID-19 and flu vaccines. Users can reach and search these areas by searching a zip code to find nearby vaccination sites. So community health centers, they're federally qualified health centers, and that's FQHCs, who often provide vaccinations on a sliding fee scale based on income. The Health Resources and Services Administration, HRSA website can help locate these centers. So as it comes to recommendations, stay updated. Vaccine availability and clinic schedules can change. It's important to verify current information through official health department websites or by contacting healthcare providers directly. You should also consult healthcare providers. If you have a primary care doctor, many of them oftentimes will offer vaccines. When the COVID vaccine first came out, I got a little frustrated with the system, and I developed a vaccine clinic in my office. And even as a cardiologist, I did that because I thought, A, it was the right thing to do. B, I had access to be able to get the vaccine, and C, I wanted to protect my community. So sometimes other types of doctor's offices may do it. I'm a big advocate for community health, and people that know me know I'm a strong advocate, especially in my community and my people. So I'm going to always do my best to provide that which is necessary to help save a life if I can. So ensuring timely vaccination is crucial for personal and public health, particularly during the winter months when respiratory illnesses are more prevalent. So emerging information about winter allergies. So I want to talk about that a little bit, because a lot of times people will get sick, and even I've had times where I felt kind of poorly, and I had to find out, is this an allergy or is this a cold? So winter allergies primarily triggered, or I should say, by indoor allergens such as dust mites, mold, and pet dander can closely mimic the symptoms of the common cold. Both conditions may present with sneezing, nasal congestion, runny nose, coughing, making differentiation challenging. However, certain distinctions can aid in identifying the underlying cause. Symptom duration. Colds typically resolve within 7 to 10 days, where allergy symptoms can persist as long as exposure to the allergen continues. Itchiness. Itchy eyes, nose, or throat are more commonly associated with allergies and less typical in common colds. Fever and aches. Colds may be accompanied by fever and body aches, symptoms generally absent in allergic reactions. So recognizing these differences is crucial for effective management. Persistent symptoms beyond 10 days, absence of fever, and presence of itchiness may suggest allergies rather than a cold. But again, don't be a hero. Consult your healthcare professional who can help give you an accurate diagnosis and appropriate treatment plan. So how can you tell if you have a cold? Well, if you have a common cold, you'll probably have symptoms that aren't associated with allergies, in addition to the allergy-like symptoms. There are a couple of board-certified family medicine physicians within the University of Tennessee that said that a cold can cause body aches and a severe sore throat, as we previously mentioned, but that doesn't usually occur with allergies. There are also headaches, fatigue, and body aches more typical with a common cold. Allergies, meanwhile, might leave you feeling more itchy. So again, I'm re-emphasizing some of these things just so you can hear them a second time. That fever we talked about earlier, more of an indicator of an infection like the common cold. So some people may get a low-grade fever up to 101 degrees with a cold, but not allergies. Plus, there's also a tissue test. If you're hawking up phlegm, it's more likely you're dealing with a cold. With colds, you produce mucus, cough up stuff, which can be different colors. It could be clear, yellow, or green. With allergies, you do not cough up any mucus or sputum traditionally. Another way you can tell if you have a cold, if your symptoms don't improve with antihistamines, people usually get more relief from allergies with allergy medications. To treat a cold, you have to look for more symptomatic care, like taking over-the-counter supplements or multi-symptom cough, cold medicine, rest, and fluids are also important. So, and if you think you got a cold, don't just go out there and again infect the rest of the world because you want to feel like you want to go out. Make sure you're take time. And if you need to wear a mask that particular day because you're trying to protect somebody else, then do that. Again, attitude of gratitude. If you're still around and you're doing relatively well, just have that attitude of gratitude and look out for those around you. Okay, so time to do a recap now. So I want to talk again about what is RSV. So that is a common respiratory virus that causes infections of the lungs and respiratory tract. Now, while RSV, again, often leads to mild cold-like symptoms, it can be severe in infants, older adults, and immunocompromised individuals. So I want to reemphasize that word immunocompromised. So that means things that affect your immune system, and there are diseases and treatments that can do that. Cancer patients on chemotherapy, people with connective tissue disorders like lupus, rheumatoid arthritis, those types of disease processes. Transplant patients, people have had kidney transplants, heart transplants, anything that's been transplanted, you're going to have to block the immune system because you're trying to prevent rejection. And under those circumstances, that's put you in increased risk and susceptibility to develop and catch these other types of virus infections. So anybody who has these other types of medical conditions, you need to be super careful. Don't just go out in public and crowded places and potentially put yourself at risk. You want to make sure you're taking necessary precautions. If you have a weakened immune system, make sure you wear a mask. If you have infants, especially under 1 year of age, adults 65 years of age or older, individuals with these chronic illnesses, or if they have chronic lung or heart conditions, typically will have weakened immune systems and are susceptible. So you want to make sure if you fit any of those categories, make sure you're taking the necessary precautions to protect yourself. Additionally, if you flu infections, a viral infection caused by influenza viruses, primarily types A and B, that affect the respiratory system, can be mild to severe and can result in hospitalization or death, especially, again, in vulnerable populations. So we're again talking about these individuals that are higher risk because of underlying conditions, and the flu and RSV can be deadly. Don't just think it was just COVID-19. There are people that die from the flu. Now, you don't see it, but you see it enough to know that if you meet any of these criteria, you will be at increased risk, and that needs to be taken into consideration. So, again, I would say, and I would emphasize this 100 times over, if you meet some of these criteria I mentioned earlier, you need to become vaccinated. Don't let naysayers and people that know nothing from nothing influence your decision to protect yourself and your family and loved ones. I remember during the COVID time, there was a older patient. She was a grandmother. She's probably in her low 80s that passed away. We didn't really realize at the time because we were still trying to recognize COVID-19, so it took us a while to recognize that's what she had. But the family had to throw her a birthday party, even though the governor has shut everything down and said we're not going to gather in crowds and what have you. But they had a birthday party for her with over 70 people there, all in close corners. Grandmother got sick, and grandmother ended up dying. And, of course, while she was in the hospital, then somebody came and said, somebody came there with COVID-19. They told us after the fact, and now grandma's dead. So, again, don't be selfish. Think of others. This is a time that, especially in this season, that we have to let the good Lord's word carry our hearts and our minds in a positive direction. So do not let other people sway you. You know what's right and what's wrong. Do not expose yourself to other people if you have a respiratory illness, when you know you don't know what those other people, what's their health situation. And if you're going to be around others, make sure you wear a mask. We used to wear them all the time. Now we act like we can't wear them anymore. But I don't want that for you or the people you may infect. So please be careful. So next week's show will involve how do we protect ourselves from the elements. Now, we talked about the viral syndromes today, but next week we're going to talk about how to protect ourselves from elements. If it's cold out, don't go out there with no coat on, no hat on, and you're thinking you're fine. There are challenges and there are risks for you doing that, and my job is to help educate you so that you live your best life. So again, this is Dr. Keith Newby. I hope you enjoyed the show today. Visit our website, www.newbyfoundation.org, for more information. I will answer questions if you blog them to me as best I can. I enjoy always our time together, and I hope you did as well. Thank you very much, and see you next week.